You're listening to an African Elements top news story for June 6, 2025. Please visit our website at africanelements.org for more daily news. Navigating Health Crises in West Africa. By Darius Spearman, African Elements. Ivory Coast Cholera Outbreak, a community's urgent struggle. A recent cholera outbreak has cast a shadow over Ivory Coast, claiming a confirmed 7 lives and alerting health officials across the nation. This serious public health emergency began in the Port Bouet Vridi Health District, specifically affecting the village of Vridi Akobrade. The health ministry swiftly confirmed the outbreak, recognizing the urgent need for intervention. The initial reports indicated a grim reality. 5 of the 7 fatalities occurred directly within Vridi Akobrade, highlighting the concentrated impact on local communities. Furthermore, a total of 45 cholera cases have been documented, underscoring the rapid spread of this formidable disease. Such outbreaks disproportionately affect communities with limited resources, often leaving them vulnerable and struggling for survival. For many people of African descent, whether on the continent or in the diaspora, these health crises resonate deeply, exposing long-standing systemic challenges. Cholera, recognized as an acute diarrheal infection, poses a severe public health challenge globally. It comes from the bacterium Vibrio cholerae, which people typically contract through consuming contaminated food or water. This infection can rapidly lead to severe dehydration, and without proper immediate treatment, it can prove fatal within a matter of hours. Common symptoms include dramatic watery diarrhea, persistent vomiting, and painful leg cramps. Most individuals develop signs of the illness within 12 hours to 5 days after exposure. It is important to know that many people infected with Vibrio cholera do not exhibit symptoms. However, they can still spread the bacteria through their feces for 1 to 10 days. This asymptomatic spread silently contributes to the rapid dissemination of the disease, especially when sanitation is poor. The outbreak in Ivory Coast stands primarily associated with inadequate sanitation practices and sorely limited access to clean drinking water. These conditions are tragically commonplace in impoverished areas where basic infrastructure is often lacking. Such environments create fertile ground for waterborne diseases like cholera to flourish, placing residents at constant risk. Africa has, for many years, carried a significant burden of cholera. Recurrent outbreaks plague the continent due to persistent challenges with basic sanitation and access to safe water. Furthermore, global climate change and weather phenomena such as El Niño exacerbate these concerns, impacting rainfall and causing extremes that contaminate water sources. This unfortunate combination creates a cycle of vulnerability, disproportionately affecting Black and Indigenous communities striving to build lives amidst systemic adversity. The official confirmation of cholera in Ivory Coast came after rigorous laboratory tests conducted by the esteemed Pasteur Institute of Côte d'Ivoire. This crucial step ensures that health officials are responding to a verified threat with appropriate medical strategies. The Institute's role in this crisis highlights its importance in disease surveillance and public health efforts within the region. Historically, Ivory Coast has grappled with numerous cholera epidemics, facing these challenges repeatedly since the 1990s. These recurring outbreaks underscore the deep-seated infrastructural issues and ongoing vulnerabilities within the nation. Each episode serves as a stark reminder of the continuous struggle faced by populations living in areas where basic amenities like clean water and proper waste disposal are luxuries, not guarantees. The current situation in Vridi Akobrade is a painful continuation of this difficult history. Effective response measures are critical when dealing with cholera outbreaks. These typically include rapidly improving access to safe water and sanitation facilities. Additionally, establishing robust surveillance systems helps to track the disease, identify new cases, and contain its spread effectively. Medical treatment focuses on rehydration as the primary intervention, using oral rehydration solution, ORS, for most cases. For severe instances, intravenous fluids and antibiotics become necessary. Prevention strategies are equally vital. Consistent access to safe drinking water, diligent proper sanitation, and adherence to excellent hygiene practices are foundational. While vaccination is available, this prevention method is not universally widespread during outbreak scenarios. The challenges presented by cholera outbreaks transcend national borders, demanding a unified global response. International organizations like the World Health Organization, WHO, and UNICEF often step in to provide critical support during these health crises. They assist with surveillance, supply vital medical resources, and implement prevention strategies that save lives and stabilize affected regions. Furthermore, the effectiveness of a country's public health infrastructure directly impacts its ability to manage and contain cholera outbreaks. A robust system includes strong capacities for disease surveillance, meticulous response planning, and reliable resource availability. Investing in and strengthening these infrastructures is essential for building resilience against future epidemics, particularly in African nations. Many Black communities across the globe witness similar struggles with access to adequate healthcare and sanitation, highlighting an urgent call for equitable development and support. The cholera outbreak in Ivory Coast serves as a sober reminder of the persistent health disparities faced by many communities, particularly those of African descent. While immediate action focuses on controlling the current crisis, the long-term solution lies in addressing the fundamental issues of inadequate sanitation and limited access to clean water. These systemic challenges require sustained investment and collaborative efforts. By strengthening public health systems, promoting hygiene education, and advocating for equitable resource distribution, it is possible to build a future where communities are not simply reacting to outbreaks, but are resilient enough to prevent them. This work is not just about medical treatment. It is about human dignity, equitable development, and ensuring every community has the infrastructure to thrive. Copyright African Elements.